Thank you. And our next presenter is Kumudu Sumedha, and she's making presentation about exploring disabled male veterans' subject positioning and gender identity construction in sexually intimate relationships.
Good afternoon, everyone. I am presenting a very small section of my doctoral research. The topic, as Sir said, exploring disabled male veterans, submission and gender identity construction in sexual intimate relationship. Before moving on to the objective, I would like to explain a little bit of the reason that I have done this research. It's basically about the lived experiences. Actually, I explored lived experiences of disabled veterans, masculinity and sexuality. It's a critical phenomenological exploration, and while doing my literature survey, actually, I found extensive research on disabled veterans in the Sri Lanka Army. However, despite this attention, there remains a glaring gap in research concerning these veterans' experiences relating to their sexual well-being in their post-conflict. So, I am Kumudu Sumedha. I am a senior lecturer in the Department of Sociology, University of Kelaniya, and my supervisor is Dr. Russell Shuttleworth, and I did my PhD at King University, Australia. So the main objective today I am presenting is part for one objective in the doctoral study. The main objective is to integrate how disabled veterans discursively negotiate their masculinity and sexual lives. So through that objective, I decided to present this particular objective, a section of that. A major objective of this research was to critically integrate how disabled veterans position their masculine subjectivity in terms of their sexual and intimate relationship. The methodology, it's a qualitative methodology, and the both methodology and the conceptual framework of the larger study draws from interpretative and critical paradigms used critical disability studies and critical phenomenology. The larger methodology actually had two phases of data collection. One is in-depth life history interviews with 12 disabled veterans, interviewing one participant three to four times, and the second phase of the research was participant observations of 7 social events. But particular to this presentation, this part actually, it's I grabbed data from these 12 interviews. So data analysis, this part of the objective was analyzed through discourse analysis, and discursive psychology is one way of doing discourse analysis. Under discursive psychology, there were three theories that I've used: interpretive repertoires, ideological dilemmas, and subject positioning. So subject positioning is the major way that analyzed this particular study. So the research was conducted with the approval of Deakin University Human Research Ethics Committee and was completed in 2023. So the results, participants, the 12 participants, those who are having physical impairments, express 3 distinct types of masculine subject positions in related to their sexual intimate relationships. So I analyzed these different findings under 3 groups. Actually, I clustered these 12 participants under 3 groups. So the first first group, the one group of research participants primarily maintain a traditional dominance sense of their masculinity and role in their sexual encounters and relationships. So here you can see the interview excerpts for an example, since this is a very qualitative study and analysis, and I actually analyzed the way that they use language to position or to position their masculine identity and also to construct their masculinity during these interviews. So for my masculine personality, it won't affect me much because I am blind only. That doesn't make big trouble. But in the case of paralyzing or physical disabilities, it will affect much. Then the feminine side should play a big role. In our case, that is different. I play the leading role. My wife is much cultured. So here, when you see how this person who is having visual impairment, so he directly positioned himself as dominant, and he said since he is blind, that doesn't make big trouble. So that means his impairment. So he said his impairment doesn't make a big trouble to play his gender role, like to play his dominant gender role during during his sexual relationships. So, but he said with compared to other impairments, so they have different limitations in playing their dominant masculine role. So also here, the feminine side should play a bigger role, mean the supportive role of female sexual part. If we move to the second group, the second group of participants were less inclined to identify as dominant and often viewed themselves as passive and diminished in their masculinity and role in sexual encounters and relationships. So this person having using a prosthetic leg, and in his situation he has to set the artificial leg aside, and he frames the sexual act immediately in negative term. Like, so you can see here in his words, we can't act drama scenes. Javanika danda beha. So as a male in Sri Lankan society, so he thought like he has to play the major role, and he was regretting, and also the important thing is these men are comparing their sexual life experience before and after. So before they're comparing their performance, like sexual performance, before becoming disabled and after becoming disabled. So that's why he's comparing his situation and saying we can't act drama scenes, we can't jump like her. So he's comparing his situation with the female partner, and so that's the reason this person is less inclined to identify him as a dominant position. So yeah, so and also you can see the feelings of depression, shame, and so thinking and comparing his situation with the social construction of masculinity, the masculine role in sexually intimate relationships. And the third group of participants, especially those facing diminished sexual function and impairment, often prioritized emotional connection and companionship and downplayed the masculine role of being sexual initiators or aspiring to dominant masculinity. So the third group is especially they are having multiple impairments, for an example like having down waist paralyzed, and also having nerve issues, so they can't move their hands, they can't move their legs. So these two two participants, they did not actually position themselves as dominant or passive. So what they expected is a romantic relationship rather than a sexual relationship. They did not express their idea related to marriage. So you can see in the given example, if I can be with someone, I don't want sex also. Just be my side and talk to me. So you can see the way this person is expanded his sexual repertoires and explaining about love, attention, care, and a partner to talk. And he said, I don't want to show the world that I am a man, but I want to feel that I am a man. So feeling like a man means that he wants a partner and to talk with him rather than performing a dominant masculine role in his sexual relationship. So these are the three groups of men that express their sexual life experiences. In the conclusion, responses on masculine identity construction were not wholly fixed, and depending on different factors and context, some men express more than one type. So here their experiences and their masculine identity construction is not wholly fixed, because it's depend on sometimes with their partner, the partners respond. For an example, one participant said, we depend on his female partner's support and yes, especially with the support of his female partner. So he feel he's performing his duty well. So, and also some men, they are having compensatory relationships. What I mean by compensatory relationship means some were married to a young woman who's having a big age gap, and some were married to women from poor backgrounds, and some were married to uneducated women, so they can compensate their relationship. So that also affected to their masculine construction in their sexual and intimate relationship. So so this demonstrates a fluidity reflecting the masculine identity's complexity, because when I discuss with them regarding their previous experiences, like before becoming disabled and after becoming disabled, so this comparison, it reveals the complexity and the fluidity of their masculinity. Those who wanted to become a man through their sexual act, like the dominant sexual act, but after becoming disabled, so they are ready to having kind of a sexual intimate relationships with a partner who they can talk with. And these various subject positions reflect the ways that disabled veterans negotiate and construct their masculine identities in the context of developing and maintaining their intimate and sexual relationship. The recommendations, whether it's happening or not, I have recommended several things to as an outcome of this study. So one is education on how masculinity intersects disability and sexuality, which is crucial for disabled male veterans as it helps address their own experience and challenges. Especially I recruited participants from several rehabilitation centers and also from the community. So mainly these education programs are medically having a more medical approach than a social approach. So I thought giving a better sociological aspect and plus medical aspect is better for their rehabilitation process. Additionally, staff who work with disabled veterans veterans and their partners should receive comprehensive training to ensure they can provide informed and empathetic support. Such educational and training initiatives must be sensitive to differences in gender and sexual orientation. This holistic education framework will foster a more inclusive understanding of disability and sexuality for everyone. Moreover, insights gained from this research with disabled male veterans on their masculinity and sexuality may also inform broader discussion relevant to all disabled men in Sri Lanka, with particular to disabled male veterans. So these are the references. Thank you very much.